Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Hello, my name is Dr. Derek Barron, and welcome to another amazing episode of the Prime Health Podcast. We interview doctors, nurses, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. We explore breakthrough science, personal and patient stories, and practical insights that are helpful to shaping the future of health and wellness. Now, before we get into today's episode, I want to do a quick note from our sponsor, who is Grow Solutions, your growth partner for busy health and wellness professionals. We help health and wellness professionals with some of the biggest headaches, such as new patient lead flow, AI and tech overwhelm, and ways to streamline the business operations. A lot of the times we find new and fun ways to generate a steady flow of qualified leads for our clients. We simplify the platforms for better communication and follow-up amongst patients. We work together to put fun and engaging campaigns to attract new patients, new staff if you need them, and amazing referral partners. And we offer clear playbooks and frameworks and automations to cut the busy work down and allow you to get away from the clinic, enjoy life more. So if you have ever said this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we'd love to help. Just drop the comment, the word grow below, and you can reach out to me on LinkedIn as well. So let's get into the reason we're here today, and that's our expert witness here on the star of the podcast. And I'm pleased to introduce you to Dr. Stephen Derrington. He's a board-certified specialist in physical medicine and rehabilitation with advanced training in interventional spine, sports, and regenerative medicine. He's the CEO and medical director of Derrington Orthopedics, interventional sports and spine, with locations in both Carlsbad and Laguna Hills, California, and we know that's a beautiful place to be. So Dr. Derrington helps active adults break free from pain and get back to the life they love without relying on surgery or damaging steroid injections. Through his signature approach, he guides patients from diagnosis to full recovery using cutting-edge regenerative treatments like platelet-rich plasma, otherwise known as PRP, and cell-based therapies from bone marrow and fat. Now, these treatments work with your body's natural healing ability to reduce pain, restore movement, and rebuild long-term strength so you can move with confidence and live life on your terms. Dr. Derrington, welcome to the Prime Health Podcast.
Thanks, Dr. Derek. Pleasure to be here.
Absolutely, my friend. So I want you to give us a little bit of a background. What got you into medicine?
Sure. So one of my best friends growing up, his dad was actually a primary care doctor. We'd go in there in the afternoon sometime and just run around the office. As we got a little older, he actually let us inject him for different things. He might have something small that needed to be, injected or poked, and he would just, let us do it. The first person I ever treated was probably when I was 8 years old, which was obviously that's pretty exciting for most kids, I think. I moved away, and kind of that idea went away for a little while, but I actually came back to it in college. Ended up spending a summer rotating with him again, and that kind of reignited my interest in getting into medicine.
Well, I'm sure your patients are glad you did. Now, you've got some pretty unique credentials behind your name with DO and PM&R. Do you mind explaining what those are unique for?
Sure. So DO is a doctor of osteopathic medicine. DOs and MDs are the only two fully licensed physicians that can do injections, that can provide medications for patients, and can also perform surgery. But DO has a different philosophy, has a different mindset than the traditional MD approach. It's a more holistic, comprehensive approach, and there's a lot of training with your hands as not only diagnostic tools, but also for ways to treat patients.
Okay, and then PM&R also called a...
Yeah, also called a physiatrist. Physical Medicine and Rehabilitation is the full name, so we like to use multiple names to try to confuse people, it seems like. But they're all basically, they're all meaning the same thing for a specialty that is geared towards getting patients to maximize their function. That can be from neurologic injuries, could be strokes and spinal cord injuries and brain injuries. The aspect that I've specialized in is more musculoskeletal orthopedic management non-surgically for any number of knee and back and shoulder, hip, and really any joint, ligament, tendon, spine problem. Most of those we can address.
Okay, so that would put you as a leader in musculoskeletal healthcare. So as a musculoskeletal specialist, can you talk about how regenerative medicine offers some practical approach using non-surgical strategies that you use in your office, specifically for common, injuries with joints or tendons, ligaments, spine, bone issues like that, to allow people to get back to a healthy lifestyle?
Sure. So like you mentioned, those are all areas that unfortunately tend to get injured. Some of those can be acute, especially if we're younger. They tend to be more, degenerative and kind of accumulation of small injuries as we get older. But these are things that can be issues that, limit us from playing high school and college sports to playing with our grandkids as we get older, or being the weekend warrior somewhere in between. And what we're doing is using those kind of injections like we were talking about, using platelets, using cells in our body to help stimulate a healing response better than what happens on its own. So these tissues that you mentioned, for the most part, they don't have the same blood supplies as your skin and your muscles do, so they don't heal the same way. So what we're doing is tapping into what our body does well, other parts of our body, isolating, concentrating, and then precisely directing those to where there's injuries, to, like I said, stimulate that healing response. So tissues that are injured that might have partial tears or just kind of wear and tear type things like tendons and ligaments, that could be rotator cuff, that could be MCL or ACL, those types of structures, we can actually get those to oftentimes heal, whether it's completely heal or just be a stronger, healthier tissue that's not painful. And then on the kind of more accumulation of degenerative changes, whether it's to the cartilage, whether it's to the disc that leads to a number of other things in the spine happening, we're injecting things that can stimulate those tissues to be healthier, more resilient, less painful, maybe not reversing the degenerative changes, but we're helping to manage them by helping those tissues be, again, healthier, stronger, functioning better, not just masking the symptoms with a corticosteroid that is actually damaging to those tissues and can speed up that degenerative process while you have that honeymoon phase where things are feeling better. But unfortunately, things are actually kind of in the long term progressing faster than they would otherwise.
Okay, so I think the difference that I'd like to explain to some people here is somebody hurt their knee playing pickleball, a big sport that's out there common right now. Typically, and sometimes unfortunately, people will only think they have to go to their orthopedic surgeon. Right. If they come into your office, what's the difference of how you would treat versus the typical orthopedic surgeon? And we're not here knocking them. We just want patients to have options. So how does your practice with these non-surgical techniques differ from an orthopedic surgeon?
Sure. So yeah, it's definitely a different approach. I do in-office musculoskeletal ultrasound that helps me on top of my physical exam skills, on top of the manual things we talked about as an osteopathic physician. That can give us a lot of information, and that may be sufficient to figure out what the problem is. We may still get further imaging like an MRI, but I'm not going to be jumping to, let's just do a steroid shot to kind of calm this down, because again, we talked about the downsides of that. Appropriate rehab or appropriate activity progression, and I coordinate with a lot of other providers that can help with that physical part of it. But if we're going to be needing to do some kind of intervention, I'm thinking of how do I get this problem feeling better now? And then ideally, how does this something that is going to stay feeling better and be better not only in a couple months, but also 1, 2, 3, 5 years down the road?
Love it. So to go along with that previous question, what types of conditions are common that come into your doors? Most
common thing we see, especially in that older population, is knee arthritis and then the degenerative disc disease, the kind of back arthritis kind of presentation. We see a lot of rotator cuff tendon problems, a lot of tennis and golfer elbow tendons. Maybe they are pickleball players, but these are things that overuse, and as we're doing lots of activity, especially in Southern California, people like to be active. And they tend to not want to slow down. So those are things that come into my office pretty frequently.
Okay. So for patients that have any of these conditions, what can you share with them why taking this less invasive regenerative approach is smarter than really jumping into a surgical approach?
Sure. So, surgery for, say, tendons or ligaments that are fully torn and have a big retraction and basically a big space between them, you need that to mechanically put those edges back together so it can heal. But if it's not to that extent, especially if it's not a big tear, these kind of treatments can stimulate that healing process, probably make some positive benefit to the structure of those tissues. And instead of having a 6 to 9 month rehab process. You might be in the 6 to 12 week rehab process, moving along the way, and you're preserving your tissue, you're preserving the biomechanics, and you don't have the downtime that can lead to other changes where we're losing muscle mass, we're losing endurance, we're losing strength, and it's, as we get older, of course, it's harder to get those back.
Yeah. Okay, so we talked about PRP as an option that you offer there in your practice, but I want you to delineate kind of the biologics options that are out there. Most people will hear what's called stem cells. So you talk about bone marrow versus fat. So stem cells versus PRP. Do you mind breaking those down for us?
Yeah, and some people, they think that PRP is stem cells. Some clinicians will even say that they're kind of the same thing and muddy that delineation. But PRP, as you mentioned, platelet-rich plasma. It's a fairly basic process of spinning and isolating the platelets, separating out the other parts of your blood, and then mixing them in the plasma, the liquid part of the blood. And honestly, there's over 40 some kits that do this. In my office, I have a lab person that does this for me. So I can actually tell him what kind of PRP I want. There's actually different versions, what concentration of PRP I want. So depending on what the patient is presenting with, what their injury is, what their age is, we're making decisions to customize that preparation of that platelet-rich plasma for that individual, for that condition. So that's all under the umbrella of regenerative medicine or orthobiologics. And then a separate portion under that same umbrella is what people usually call stem cells. Now that can be, in the United States, legally, that can be using bone marrow cells. Adipose can be technically considered a stem cell procedure. There's some semantics why maybe it shouldn't be, but they both are using our own tissues, our own cells to stimulate probably a stronger healing response than what the platelets themselves can do. And that's kind of separate from the international birth tissue sources, as well as tissue sources like that are in the United States that it's kind of a muddy water where what the claims are, what the safety is, that gets kind of, unfortunately, a little bit complicated and confusing. But using your own body's tissues, whether it's bone marrow, whether it's adipose, as long as you're not manipulating things too much, is approved under the FDA. You're allowed to do that. They're compliant with how we can process things. And we can do that to stimulate a lot of significant healing that might otherwise need surgery.
Okay, so when patients are coming in presenting to your office, you're in California, it's a very active state, thank goodness. But I would assume, can you tell us the importance of having overall good health coming into the practice versus somebody that is, we can each have arthritis, I understand that, but you have a healthy patient that's coming in versus somebody that has, not optimal health. Yep. Do you suggest they take steps to do before you actually go through the intervention that you offer?
Yeah, there hasn't been good data to show that that's going to make a difference, but invariably, if you come in healthier, it would make sense that you would, have a better chance at having success. So that's one of the conversations I have with my patients. And again, I have a network of people that we work with if patients need a lot of guidance there to manage with weight management, just losing some weight, because that can obviously make a difference, especially in back and knee and hip problems. The dietary choices, how much protein they're getting, how much fat they're having, what kind of carbs they're having, what those sources are and how much. All those things, really should be optimized. A lot of patients that come to me are already pretty well dialed in. There might be some small tweaks that we make, but there are patients where we say, hey, we need to be doing some other things first. Let's see you back in a handful of months once you've made some of those changes, so you've got a better, a better presentation when you start, so your body is ready to accept that treatment.
Yeah, I love that approach, Steve, because you're allowing the patient to give themselves a better outcome. The truth is, with some orthopedic surgeons, not all, they don't care what your condition is because they know one thing, they know two things: refer to PT potentially, or to do surgery. And why not give that patient a better chance at a better outcome? So I think that's a great approach that you go through with that. So something else that's unique is when you're offering these types of injections that you do, whether it's the PRP or the biologics that falls in that with the stem cells, what happens if I'm a pickleball injury, I did rotator cuff damage? What's my after injection care plan for me? When I leave the office, what do you tell me to do? Can I go and play tomorrow?
Yeah, no, you can't. Some patients that do push the envelope, but we give them a structured plan to go through. oftentimes corresponding with their physical therapist. And if I'm sending them out, I'm pretty picky with where I send people, but it's going to be a graded activity progression. You take it easy for the first handful of days afterwards, but it's different than surgery where you might be in a sling for a couple months. You're getting moving appropriately based on what the injury is, and then how you feel as you're making that progress. And you're gradually advancing different types of activities, different intensity, different duration, depending on, the time after the procedure, but also how your body is responding to that. Because everybody responds to these treatments at different times. It's something that oftentimes takes several weeks, if not multiple months, but how you're progressing through that is a little bit individual. So that guidance that we give, and then the kind of hands-on ongoing guidance from a physical therapist, really helps to make sure that, we're guiding them through that process appropriately, and they're giving themselves the best chance to get better.
Okay. So I'm a patient of yours. I come in and I get the injection. I go to my PT. I go through some rehab. I'm feeling good. Or there may be a time that I'm not. How often do you potentially treat that patient again with very similar biologic improvements?
Yeah. So I think when you do a quality job of what you're injecting, some of the processing we were talking about, and then we didn't talk about it yet, but using image guidance to make sure that what you're injecting, as good as it is, that you get it in the right spot. Because, of course, the best treatment in the world, if you put it in the wrong place, probably isn't going to be as effective as it could be. So as long as we've done those things, a lot of times these can be treated once, sometimes twice. Like I said, there's a little bit of a period of time where things are expected to be getting better. I always follow up with patients a couple months after their procedure and really evaluate where they're at, what kind of progress they've made, what that trajectory of improvement is. And then we're making a collective decision of, is this moving in the right direction? Are we a little bit slow? Has this plateaued? Does it maybe need something else? And we have some ideas on what kind of things are expected to respond to one treatment or maybe respond to additional treatments based on the severity of that injury. But again, everybody's a little individual. So I'm treating the patient. I'm not treating what their pictures say. I'm not treating, just what the report of the imaging is.
Okay, so you brought up a great point. Patient comes in, I myself, x-rays, MRI. We realize in the care plan that you say, okay, Derek, we're going to do PRP or we're going to do some stem cells. How do you know where to inject? Like, what do you use to make sure you're very specific in the injection process?
So I guess a couple different points to that. So one is figuring out, based on the imaging, based on the symptoms, based on the exam, which of these structures that might be damaged on whatever imaging we have is what's causing their issues, and what also is contributing to it. So once we've figured out where to inject, knowing how to inject in those places is paramount. So using ultrasound guidance is a way to visualize a lot of times most of the soft tissues in our body, and we can get into several joints very reliably using that image guidance. There's certain areas in some of our peripheral joints, so in certain areas of our knee or our hip or our shoulder that might benefit from the addition of using fluoroscopy or live x-ray. Most spine injections, you need the live x-ray because that can visualize those spaces better, where the ultrasound, basically the sound waves get blocked by the bone and they just can't see those issues well enough. So I'm able to be nimble with using one or both of those imaging depending on where we're injecting, and that helps us to make sure that we're getting what we work so hard to prepare into exactly the right spot where it needs to go.
From the injection standpoint, where you can help patients, are there any other services or devices in your practice? As I read on your site, you offer laser therapy. Can you explain what the laser therapy can do, maybe by itself or on top of some of the services that you offer?
Yeah, great question. I mean, some conditions may not need injections. Some patients are like, if I can avoid an injection, I'd rather do that. But like you said, they can also be combined together. So we have a class 4 laser in the office. It's specifically called MLS. It has a multi-wave locked system that has multiple different class 4 lasers, different wavelengths, and that can penetrate deeper than what red light laser can do or a class 3 laser. And the automated head allows me to make sure that the energy that we're delivering through the light energy, the fancy word is called photoacoustic biomodulation. It's a fun thing to say. But that ensures that delivery of the energy is being directed consistently where you want it to go. Because this is something that typically takes a handful of sessions to do, and you want to make sure that you're delivering that consistently every single time. So that laser has been used by a number of clinics that do a lot of regenerative treatments, And one of the nice things about it is through collecting data, we know that using that treatment in addition to a very good quality PRP can elevate the outcomes and probably speed up the improvements compared to that same very good PRP done by itself. So as we're working on the nutrition, lifestyle, and we're working on what their rehab is, what their activity is, we can do things from a cellular level using growth factors and cells in our body to stimulate healing. We can also use that light energy to stimulate that. It can reduce pain, reduce inflammation, but also facilitate tissue repair to maximize that effect of what we're doing from all the other components that we're trying to take care of.
Okay, with this MLS laser and kind of the modulating, articulating head that it does, so basically you could do wrist, you could do elbow, shoulder, low back, cervical. I mean, you can do many, many joints, I would assume?
Yeah, you can really treat just about anywhere. There's very limited limitations. Patients that have hardware in their body from fusions and joint replacements, that's not a problem. So like I said, it's something that works really well for most people. There's very little contraindications. And something that can be used for any number of tissues, like you said, whether it's a joint problem, whether it's a ligament or tendon problem. We use it a lot for soft tissue, muscle pulls and strains for our either weekend warriors or our high school athletes that might have pulled a hamstring or a calf or things like that.
Okay. So I want to ask a few questions from a business perspective, and I'm going to jump back into some patient outcomes that you get at your office, which sound like it's fantastic. So do you feel as though there's been a demand for people searching for regenerative treatments?
There definitely has been. I mean, I've been in this field for a while now. It's been around in the U.S. for over 20 years. Initially, people didn't really even know it existed. They thought you had to go over to Germany like Kobe Bryant did a number of years ago. But a lot of these things are available in the U.S. here, and people are getting aware of it. And whether it's previous patients that are being told about it, I actually had someone yesterday that was a direct referral for the same kind of shoulder problem. She's like, I want that treatment. But people are aware of it and they're looking for it. And one of the things I think that's important from an education standpoint is understanding that it's not all the same, and who's doing it really matters. But patients are interested in it. Most people don't want to run to surgery. Most good surgeons don't want to put you into a surgery that you're not appropriate for or not quite ready yet. This really should be, because especially some of the outcomes we see, this should be one of the first line things that you do before having surgery for most conditions.
Okay. So I love how you're explaining that there are, you are giving people a primary option first. They should seek care with you before they go to the other option of cutting, surgery, those kinds of aspects. So how is it that you feel people are finding you to come into treatment for you? Are you referral based only? How do you think people find out about you?
It's a mixture of things. I mean, of course, in today's day and age, website optimization and SEO is important. Making sure that people, when they're looking for these kind of things, can find who you are. We get quite a few patients that are coming from, they've been working with a physical therapist, they've been working with a chiropractor, they've been working with, their surgeon sometimes, and they're familiar with who I am, and they say, this is the kind of person that you need because maybe this isn't surgical, maybe it's not surgical yet, maybe the rehab isn't progressing the way that they expect it to, and this could be the missing link. And then obviously, like I said, there's patients where, it's their family members, it's their friends, it's the person that they play pickleball or golf or tennis with. And they're like, you had that same problem, right? What happened? Those patients kind of tend to come in, because they're hearing, they're seeing and they're hearing their friends and their family members doing stuff that they had a hard time doing before. And, that gets them excited because, like I said, most people, if they don't need it, they would rather not have surgery. And this can be, a great choice.
Yeah. From building your practice, from when you started your own practice, what has been probably your biggest challenge or in scaling the practice that you've experienced so far?
Well, first challenge, I worked in the clinic that I now own before, but I started running the practice myself in March of 2020. So there was a few things going on in the world that made life and business and just about everything challenging. So that was the first thing that I encountered, which we had to figure out, how to manage and how to provide care safely. That was not an easy thing to do. but figuring out how do you make the next steps to, be as efficient as you can with handling patients that are reaching out to you and giving them, we try to give basically a concierge level orthopedic, experience for them. And that takes a lot of people involved. So getting systems in place, getting structures in place, so the staff is aware of how to be handling things and is knowledgeable and is trained, so patients who are reaching out can get the answers that they want, and have that be something that they can handle. So I'm able to take time with patient care and doing procedures, and they're helping with the information on the front end to, if they're interested in what we do, help them come in.
So I always ask this question of people just to see what's out there. If I can pass across a magic wand to you and you can, shake it and pixie dust comes out, are there certain things that you wish you could change in the practice that you feel are holding you back? It doesn't have to be anything that you're doing. Is it from a patient perspective, a community perspective? What would you wish you could wave that magic wand and improve?
I think, one thing is just all those things talking about systems in place and having all education. That's a challenge. And having good staff, having well-trained staff is a challenge. So that's something that, if you could have that be a non-issue, that would be fantastic. But I think every industry deals with that, and that's just kind of part of running business. I think that, one of the things I'm trying to work on is, just education with other physicians, with the local community about what their options are even. Because as much as I mentioned that these kind of treatments are, 20 years old in the US, and in some countries it's much longer than that, is still lagging behind where I think it should be. And especially with the amount of research that we have showing benefits for good quality preparations of these kind of treatments, having patients be aware of it, understanding, what it can do is I think something to be really valuable.
Yeah. So I'm going to ask your advice for somebody that was in your position before you started your practice. PM&R, DO, MD, no matter what it is, what advice would you give that physician that's saying, do I pull the trigger and go out and start my own practice?
So, you've got to have the right kind of mindset, and you have to be willing to put the extra hours in, because it's obviously it's a lot of extra work, and you're balancing running things, managing, and having a business with providing care. So you have to be committed to wanting to put that in. And one of the things that I really liked was the freedom to be able to make some of the decisions. They might not always be right, but I'm the one ultimately that makes the decisions for what we're doing inside the practice. So having that ability to be able to make those decisions without having to go up the ladder to somebody else to get approval, that's something that is valuable to me. I can also control my schedule. So if I want to take a day off to go teach at a course like I'm doing later this month, or if you want to take a family vacation, I can take those days off. So I have some flexibility. It is extra time and effort, sometimes during office hours, sometimes it's afterwards. But if you like to have that control and like to have some of that freedom and are willing to put the work in, it can be something that you can build into really whatever you want it to be.
Okay, so you mentioned something here. I think there's two things that are unique about you being in practice, where you are speaking at a conference, or you speak at conferences. Tell us about that, how you kind of help, I assume, educate the public, but also educate other providers.
Yeah, so I benefited from a lot of excellent education. I think that my residency training, my fellowship training were fantastic. And after I completed those, there's always, you should be a lifelong learner. Anybody in life, and I think in medicine, things are changing so fast. You have to be able to be, still be engaged and stay on top of what's happening. So I've been involved with several organizations. I went through some of the training, and I saw the value that those provided. I teach with a couple different organizations, giving lectures, but also doing hands-on, didactic kind of training for procedures, and then for ultrasound diagnostics. So, like I mentioned, later this month, I'm going to be going to ortho-sono course. It's been going on for, how many years is this now? 10, 12 years, I believe. Two orthopedic surgeons started this a number of years ago, and there's a very big community of excellent faculty that continually come back to this course, twice a year to do the teaching. So working with Donnie Buford and Ben Dubois, who started it, has been fantastic. And there's, like I said, a great network of physicians that are the trainers there and the lecturers that are giving expertise. And if someone is interested in learning how to do ultrasound, and this can be physicians, this can be PAs, NPs, chiropractors, this kind of runs the spectrum, because I think that the power of ultrasound as a diagnostic tool, as well as a procedural guidance tool, is so strong that getting that information out there and getting more people experienced in it, I think is very valuable. And then the other organization that I do a lot of work with is called the Interventional Orthobiologic Foundation. This is one of the largest organizations in the community of this orthobiologic space. And they've got an annual conference that is always fantastic. And then they have didactic courses throughout the year on different body areas. So you can be learning how to do different procedures using fluoroscopic guidance, using ultrasound guidance, but also learning, why do I do these procedures and when do I do them? And how, it's not just I'm the person doing the injection, and someone's got to tell you how to do it right. And that should be you working from the evaluation, examination, the radiology review, and figuring out what do I do first. And then, okay, now it's like, how do I do it?
Okay. So from a patient success or patient outcome perspective, what metrics do you use in your practice that help you delineate, okay, this is a successful patient outcome?
So a couple different ways. The organization I'm affiliated with, called Regenerative, has been around for 20 years. They were the first people to use bone marrow cells to treat orthopedic conditions in the U.S. This has grown into a very large organization with 150, almost 200 clinics, I believe, around the country. And there's a registry that's been around since the beginning that is tracking patient outcomes from pain, from function, and their overall perceived changes over time. And that's actually available on the Regenerative website. Additionally, the follow-up that we're having with patients, we're seeing, again, how are they feeling? How are they doing? What are they able to do? And in certain situations, we will be getting imaging as well. A lot of times we're tracking, basically what can they do and how are they doing it and what are their pain levels. But there are times when we'll get imaging afterwards. And it's really cool when you see an ACL injury that was a complete non-retracted tear look normal, and the radiologist reads it as normal, or an LCL tear that looks like that. I actually have a patient had a large disc extrusion, so basically the disc had herniated backwards and then migrated down, I think it was 17 millimeters. Understandably, that's likely to cause a lot of significant leg symptoms and also back symptoms. We treated this gentleman 2 different times, and we've actually had 2 different MRIs afterwards, and he still has a bulge, but it is not extruded down, and he's been able to work as a manual laborer for a number of years since then. So it's really fun to see the pictures to match with the patients, but really, the way that we, like I said, we normally track this is, what are they doing and what are they able to do? And obviously one of the things that, shows us tracking their outcomes is when that person sends us, their loved one or their family member or their friend.
Yeah, that's good. So builds on the referral base and the trust that's there. So that's an extremely impressive patient result that you just discussed about the guy with the herniation. So is there any, maybe that's one, but is there any success story that you'd like to share for us to understand how what you did, and maybe they were struggling somewhere else, they came into your practice and you helped them, get back to the life they want to lead?
Yeah, I mean, so like you mentioned, a lot of people, their first person that they see is going to be the orthopedic surgeon. And I think we both would agree that, go to the surgeon when you need surgery, but there should be people that you see and steps along the way before you do that. But, I see patients frequently that are, they might even have an appointment scheduled for their knee replacement, or they're being told that the only thing they can do is get their shoulder replaced. I've got several patients that I can think of, 2 with knee, actually 3 with knee arthritis. One of them had multiple ACL surgeries, had multiple meniscectomies, and was basically not able to do much. And now I think she's 6 years out, and she is able to play tennis 4 times, 5 times a week. She rides her bike. She can climb in and out of a boat. She actually lives in Maui. She couldn't do any of those things before. Another person sent me a video 2.5 months after his procedure with me, skiing at Mammoth. He would have been recovering from knee replacement, but instead he was enjoying the winter. And then one of my favorite patients, I think he'd run like 15 or 20 marathons before he saw me when he was growing up, and he was on the verge of replacement. And he's still now running with his son, I think the patient is in his 70s, the son is 20 years younger. They're running together 7-8 miles on the weekends. And, pickleball players that are out there competing at a higher level than they were even when they were healthy, and not recovering from replacement. So hearing those kind of stories and seeing the people doing what they're doing, and when they send me pictures and videos, and that's the kind of stuff that makes things really rewarding.
Yeah, it is a rewarding part of practice when the patients can tell you, like we can tell their pain is down, the number, but it's really how they live their life after, of getting them back to health and wellness and living a better life. Right. I've got two more questions to ask you, Steve. One, it's about you being a differentiator. You're done that by going out into private practice. You have successful results with patients. What do you do better in your community than anybody else?
I think one of the things is, we take a lot of time with our patients. Like I mentioned before, concierge level from the beginning. We want that to be what their experience is from everybody, even before they make it to me and even afterwards. But I'm spending time, and I think that education is an important factor of that. For initial consultations, I'm taking 60 minutes with patients. We're taking a thorough history, we're examining, we are, like I said, using ultrasound a lot of times, we're reviewing imaging, and making sure that the patient understands what their problem even is. Because a lot of patients, they go, I'm supposed to have surgery, but I'm not even sure why or what it's for. And I think that it really empowers people when they understand what their problem is. And then you have the time and ability to go through what their options are. Everything from steroids to surgery and whatever's in between there that's appropriate. So that's one thing that is unfortunately very uncommon in today's medical system. We just don't have the time to do that for a number of different factors. But I've just made sure that we built that into how we take care of patients, and that allows patients to be more informed, and they make whatever decision is appropriate for them.
Okay, I'm going to throw in one other question here that I just thought of. As you explain that, do you see patients locally? Yes. Do people come in, because you said somebody from Maui? So if people are interested in what they see from this podcast, do you see people from outside of your regional area?
Yeah, we do. I had a patient a number of years ago come from New Zealand. I had someone come from New Caledonia, which I had to look where that is. It's east of Australia. But we get a handful of international patients. We get patients that, come from all over the country. So, we do telehealth appointments, and depending on what kind of evaluation is done ahead of time, a lot of times we can figure out, what needs to be done and have them come into the office, do the evaluation, confirm everything before doing any kind of procedures. We have, I think, a good presence locally, but as word spreads, sometimes people hear about us and they might live across the world.
Cool. So if somebody has watched this or listened to it and they're like, I have to get in touch with Dr. Derrington and his practice, how can they get a hold of you?
Several different ways. I mean, phone call still works, obviously, 760-721-4000. Emails can go to info@darringtonortho.com. We've got a website, Derrington Ortho, of course. And I'm on social media, SoCal Stem Cell Doc on Instagram, on Facebook, TikTok's coming. So a number of different ways to reach out. So I'm happy to answer, questions to see if it makes sense to kind of go further with an evaluation, or if you're, want to answer more, have some more questions answered. My staff, like I mentioned, is really educated and can go through those things. So reaching out whatever's convenient way.
Fantastic. Well, thank you for sharing that. And I do have to say, Dr. Derrington, it's been a pleasure to chat with you, get to know you a little bit. We've had a couple of calls in this prior to us doing the podcast, so it's been great for me. You've got a unique perspective of how you, from 8 years old, essentially started into medicine, if you wish. I don't know too many people that say that other than putting a Band-Aid on someone. But you really run a full spectrum within your practice. And your goal really is to have that concierge approach to people and get them better living to the way they want to live. So for our listeners, if you found today's conversation valuable, please subscribe to the Prime Health Podcast on any of your favorite platforms. And if you found this useful, please share it. And this is not sharing for me, it's for Dr. Derrington. He does a great service to people. Maybe somebody you know, somebody you have coffee with, somebody you ski with, whatever it may be, but share that with them. They don't have to live in California to take advantage of those services. So until next time, remember that true wellness is a journey we're all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So take care of yourselves, and we'll see you next time.